Eric, thank you very much. In Health News today, we are talking about infant mortality and efforts to reduce that number. Dr. Mark Wilson is with us today. He's the head of the Jefferson County Health Department, and thanks for joining us. We are starting a regular segment with Dr. Wilson, who will be with us and talking about things that are very important to our viewers and to us. Good to see you.
Good morning.
Infant mortality, it's sad when you look at it some ways because the numbers have gone up. Where do we stand now?
Yeah, actually in Alabama they've gone down slightly, but they're still about the worst in the nation. And our nation as a whole is one of the worst in the industrialized world.
Okay,
so it's a major problem.
That is heartbreaking to hear. Why is that so bad?
Well, there are a lot of different factors, and part of it is what we discussed before, things like poverty, racial disparities. But I can go through a list with you if you have that to pull up, and we can talk about that.
All right. The first thing on the list we're going to talk about is safe sleep. What do you mean when you refer to that?
Yeah, this is really important. We like for people to think about ABC. So A standing for the baby should be alone in a crib. It's okay for the baby to be in the same room, but not in the same bed.
Okay.
The second thing is B, meaning the babies should sleep on their back. There's no longer any controversy about that, but some people still are a little confused about it. And then,
let me interrupt you real quick.
Sure.
Why was it back and forth on how a baby should sleep? Why did that happen?
Just some trouble getting the evidence together, but now over time there's been an overwhelming amount of evidence that being on the back is better. I think it was just because different theories were being developed along the way about why that happened.
Okay.
And then the last one is C, meaning the crib. The crib should be free of any clutter, no bumper pads, no blankets, no pillows, no toys, because those things sometimes block the baby's airway.
So it really is reteaching some things that we as parents have been taught for years, right?
Yeah, and sometimes grandparents who insist on doing it a different way. So that's one reason we want to mention it to the public to help get that down.
Okay. And the second thing we talk about, smoking cessation. What does this mean? I know what it means, but what does it have to do with what we're talking about?
Well, it's extremely important in general, but especially for pregnant women or women who are thinking about having babies. So we really want to help women quit smoking. On the screen there you can see the Quit Now number, 1-800-QUIT-NOW, to help anybody quit smoking. Free advice, counseling, and tobacco replacement products to help people get off cigarettes. But for infant mortality, women who smoke when they're pregnant, much higher chance of sudden death, prematurity, baby ending up in an intensive care unit, heart defects. The list is long. And
we were looking at some of the video of one of the babies on a ventilator, so that's what happens.
It's a very tragic thing and extremely expensive.
All right, our third thing on our list here, I've lost control here. What's next?
Making sure that babies aren't delivered too early. So there's been a little bit of a popular trend for women to get an elective delivery early.
Which means you schedule it.
Yeah, scheduled just for convenience and not for a good medical reason. So about a quarter of our hospitals still have some unnecessary early deliveries. We're trying to get that number down to less than 3% by the end of the year. So hospitals are really working on making that a hard and fast rule.
All right, the final one, what is interconception care?
Well, if there's a woman that's had any kind of complication during pregnancy, we want to make sure that woman, and really all women, get a follow-up visit after pregnancy to make sure she's staying healthy for the next pregnancy. And that includes a whole lot of different things, but we need to make sure that women are ready to be pregnant again. Also, delaying the time to the next pregnancy, not making them too early, so that the woman has time to get healthy again and recover.
Okay.
So I just want to mention one other thing, not exactly related, but partly in terms of maintaining health. The health department tomorrow has free STD screening for sexually transmitted diseases. We usually charge $5 if somebody comes in. So we're doing it free tomorrow, and it's all private.
Okay.
And it can be done simply with just blood tests and urine tests, so people don't even have to take their clothes off to get tested. So
thank you very much, Dr. Mark Wilson. Thanks for coming by.
Good to be here.
Now let's go to Jay.